I am Dr. Geeta Subramanian, Emeritus Professor of Cardiology, Dr. Tamil Nadu, Dr. MGR Medical University. I am a cardiologist as well as a general physician. And at this juncture, I thank the Chennai Turns Pink initiative to give me an opportunity to participate in this drive against breast cancer. And as you all know, we concentrate a lot on heart problems, BP, sugar, etc. Many a time we feel cancer may be a disease which may not attack us. Maybe it is a wishful thinking, but in general, everybody has a feeling that I may not have this disease at all in my life. But is that true? Nobody bothers to even just think about it. But once they get the disease, they say, why me? This is the question. Anybody asks, why me? And then what next? But they easily forget that in the present day world, so much of changes in the lifestyle and stressful life, cancer has come to be a number one killer in all parts of the body. In women, the topmost killer is breast cancer, followed by carcinoma cervix. Now, many people think the cancer of the breast is the disease of the old age women, menopausal women. Is it true? There are about 20% of people with breast cancer are below 40 years. Can you believe it? In that case, what does it mean? It means at any age we should be vigilant and we should understand prevention is better than cure is the old saying for the old century, that is 20th century. In 20th century, 21st century, prevention is the only cure. The reason why? Because once a person is diagnosed with such a terrible diagnosis as cancer breast, it completely turns a life upside down, and you are getting exposed to so many complicated treatments and have to suffer the side effect of the treatment. So, I would like to stress what are the causes for the breast cancer. As I already told you, age is an important factor, increased life expectancy, early attainment of puberty, late menopause, and no childbirth or delayed childbirth, and improper breastfeeding, and individual changes in the architecture of the breast, too much tight clothing which may produce some amount of lymphatic stagnation in the breast and predispose to cancer, and then oral contraceptives and menopausal women hormone replacement therapy is one of the dangers. And then, as you know, present day people, young people are addicted to high fat diet, the form of pizzas, burgers, and a lot of other diets with lot of chemicals, additives, the name of which we don't even know. Almost food is like a poison with lot of hormones, especially estrogens may be there. And any fat we consume in our body can by itself turn into estrogens and put us on the risk of cancer of the breast. And then prolonged sitting, lack of sleep, stress, and obesity is an important factor. And as you all know, diabetes could also be a factor because it alters immunity. So anything that alters immunity can also predispose to cancer. Having known these predisposing factors, we should know how to prevent them or control them. Then next, now how do you diagnose early stage of breast cancer? Should we wait for breast cancer to occur? Not necessarily, because family history is also a very strong pointer for breast cancer. People with family history have 5 to 10% higher incidence of breast cancer, and people in whose family the genes are there for breast cancer, that is the breast cancer BRCA antigens are there, the breast cancer antigens are there, they have got 60 to 80% higher incidence of the breast cancer. And as you know, the Hollywood actress Angelina Jolie had bilateral prophylactic mastectomy because she wanted to prevent cancer, breast cancer. Her grandmother, mother, everybody was a cancer patient. But we need not go for such sort of prophylactic mastectomy. People with this the gene in their blood should have periodic examination of the breast and mammography, ultrasound the breast. And many people think mammogram is a very painful procedure. Okay, but is there any easy method? Yes, self-examination breast is a very ideal method. So you can, when you are taking bath, there are 6 symptoms normally you should look for breast cancer. The first thing is there will be changes in the breast with a lump or hardening of area of the breast, or changes in the skin of the breast like the orange skin, and then changes in the nipple with the nipple retracting inwards, or some discharge, bloody discharge from the nipple, or some glands in the armpit. These are all the 6 major symptoms of breast cancer. So you can routinely evaluate yourself when to personal checkup of the breast. Normally 4 to 5 days after the periods, the breast will be less painful, less tender. So you can examine yourself. First, you can stand, when you are standing in the shower, raise your arms, look for the glands in the armpit. Then you stand in front of the mirror, keep your hands on both the waist, and look for any changes in the color of the nipple, or the direction of the nipple with retraction, or change in the size of the breast. Then you can, this is standing, then lying down. When you lie down, just examine the breast from outwards to inwards and gently feel with the flat of the hand. If you try to feel with the tips of the fingers, everything may look like a lump. And especially in women, before periods, there may be some amount of pain in the breast called fibroids, where you may find some lump-like things. You need not bother about that, because that painful thing will not be cancer. And another condition called mouse in the breast, this fibroadenoma, there will be small swelling traveling all around the breast. So, having found a lump in your breast, what will you do? Don't panic. Go immediately to a doctor. Let the doctor check you up, and your doctor will ask you to do a mammogram, ultrasound, and if that is not really clinching the diagnosis, he will ask you to do a needle biopsy, that is FNAC. So, fine needle aspiration and cytology is there. So, early diagnosis made instead of waiting for a large lump to come. Then go for complicated treatment like radiation, chemotherapy, hormonal therapy, and having side effects of the treatment. The first thing, as soon as you diagnose, if it is adequately treated, properly treated with radiation, sometimes you may not even require any removal of the breast. There are a lot of myths in the world. They think once a cancer is diagnosed, my breast will be removed. Or some people think I have a very small breast, so I will not have cancer. Then, of course, we are talking about cancer in the women. That's why we say about the Pink Initiative. But there are men also who can have breast cancer. You should not forget it. Even in US, about 1,600 men a year have cancer. So, side by side, you must also want the men folk that you can also have breast cancer. Then some women think that if there is no family history of the cancer, they won't have. It is not so. It all depends on their lifestyle and food habits and their obesity, everything. So you should not think that it's not possible for me to have cancer. If you think it could be a possibility, the advantage is to take steps right on time and get cured and live long and long and long and long forever without any problem.